There's a lot to cover. Obviously, a lot going on. On the vaccination update, based on our data, Rhode Island transitions into what CDC quantifies as high transmission yesterday. Our hospitalization rates are stable over the last 2 weeks, and over the last week, we had reported one death. I want Rhode Islanders to know that we are watching this Delta variant very carefully with the Department of Health. I just got off a relatively long call with them, and so we're monitoring this on a daily basis. It remains true that the number one thing that you and your loved ones can continue to do to protect yourself from COVID-19 and the Delta variant is to get vaccinated. As of today, just under 80% of the adults 18 and older have received at least one COVID-19 vaccine, which again is in the higher echelons of the national rankings. 72.5% are adults 18 and over are fully vaccinated. And Rhode Island continues to remain in good shape in terms of vaccination, but we need to keep going. We know that as of a few hours ago, we have about 205,000 Rhode Islanders who are currently not vaccinated. And we're going to be counting that number down every week. If you recall, I think 2 weeks ago we talked about that number being about 250,000 based on my conversation with Brown University's team that's doing a lot of the modeling for us in terms of the infection rates and in terms of the projections. So that's progress, and we're going to continue to monitor that, and we're going to have more and more detail to break down what that 200,000, 205,000 looks like: men, women, age, community, different types of race, and all the way through, and so that we can start to really zero down in terms of how we're going to move forward in terms of encouraging and providing the opportunity for each and every Rhode Islander to get vaccinated. So I repeat what I said before. The number one thing that we can do to protect yourself and family and to ensure we don't need to take any steps backwards when it comes to our economy or opening our schools is to get vaccinated. More than 700,000 Rhode Islanders have got at least one shot. Think about that. 700,000 people have got vaccinated since the program started and the vaccines were available. And I would also say at this point in time that there was a time when our supply didn't meet the demand. It's the reverse now, right? So there's no excuse for not getting vaccinated based on supply. And we've made that, as we said a few months ago, we had built the supply up to do 120,000 shots in any given week as we were vying for the vaccine and put the state in a position where it received hundreds of thousands of extra doses as a result of that build out in the capacity. So today, everybody can get vaccinated. We have another threshold that we have now have reached where Rhode Island administered its 20,000th first shot in just the 4 weeks since the Rhode Island Vax Challenge has been open. It's a great start, and even ahead of schedule considerably. I announced that round 3 nonprofit winners this morning at the Elijah Project with the Rhode Island Foundation. And just last night, I was informed we also crossed the 4th milestone of 20,000 doses. So we'll be announcing the round 4 winners in the next few days. We are also continuing our vaccine days of action. These are on the ground, community-based efforts to get people vaccinated in what we call cold spots, areas that we can see have lower vaccination numbers. And we started this effort in Woonsocket a few weeks ago. We were in Newport last week, and we'll be in West Warwick later today. Starting at 4 p.m. at Thunder Mist Health Center in West Warwick, you can walk up or drive through to receive a COVID-19 vaccination right from your car if you choose. We've been doing this both down in North Kingstown, I believe, and also at Fidelity in Smithfield, and those are very successful and very convenient. Later this week, we'll be at Buckland Park in Providence as well. And if your business or organization wants to hold a vaccination event, reach out to us. We'll go wherever there are arms and that need to be vaccinated. And then talk to your loved ones about getting vaccinated. Yesterday I was at an event to support a local Northern Rhode Island Boys and Girls Club, and a sidebar, and I actually received another message from an individual that had spent 60 days in the hospital. Yet his family still, many of his family members are still unvaccinated. And he wants to step up and actually tell his story in terms of like why we should be getting vaccinated in the state of Rhode Island. Again, it protects your family, it protects yourself, it's good for your community, especially as we're dealing with the Delta variant. And additionally to that, it helps us maintain our #1 status in terms of reopening our economy in the state of Rhode Island, in the Northeast, and in the top, average the top 5 in the country. So that's really important to do. On Rent Relief Rhode Island, I know that the Lieutenant Governor and I have talked almost weekly about the Rent Relief Rhode Island program and Rhode Island housing, and I want to mention it again. If you're a Rhode Islander who is behind on your rent, or you are struggling to get on your feet and believe you will have difficulty making rent payments going forward, I want you to call this number, 1-855-608-8756. I'll repeat that, 1-855-608-8756. I'll ask everybody to make sure that the number is well publicized. That's where you can go if you are struggling with your rent at the moment. I want to make it an important point that Rent Relief Rhode Island is not just for Rhode Island's experiencing homelessness. For example, if you are a family of 4 making less than $70,000, experienced a financial hardship due to COVID, such as increased expenses, a loss of job or interruption on your job, loss of income, medical bills due to COVID, and have some past due rent, or are struggling with your upcoming rent, you very well might be eligible for this support. So I would call that number, 1-855-608-8756, if you have any questions. We recently have sent a letter from our office to the Rhode Island Housing expressing our concern about the pace it's going out. But unless there's a response from people who actually are in need, we are not going to distribute as much as we should be distributing in the state of Rhode Island. I also want to make sure that people know that these funds can also be used on past due utilities. This is something our team is really digging in on. I asked the team to reach out to the National Grid and get the list of people who are overdue on their utility payments. Over the next couple weeks, Rhode Island Housing will be doing direct outreach to these individuals to let them know about the program and to hopefully assist them with their past due bills. Originally, we wanted to be able to use these funds to make direct payments to the National Grid for those with overdue bills. Unfortunately, the strict guidelines that come along with these funds wouldn't allow us to do that. At the moment, we are doing one-to-one outreach with the individuals that the National Grid has identified who are behind on their utility payments. So I'll be sending a letter to the U.S. Department of Treasury outlining some of the concerns we have with the restrictions on how these funds can be dispersed for both rent and utilities. Tomorrow I have a call with Gene Spelling, who is the White House lead on the implementation of stimulus funds, and I will be voicing my concerns with him as well as I have voiced my concerns with Rhode Island Housing over the last several weeks. On the Office of Diversity, Equity, and Opportunity, update on that. Last week I mentioned we will have a new hire in the Office of Diversity, Equity, and Opportunity, or what's commonly known as ODIO. Today I'm pleased to announce that Tomas, T-O-M-A-S, Avila, is the Associate Director of that office. Tomas was Executive Director of Millennial Latino Institute for over 12 years, and has an extensive senior leadership experience with local nonprofits dedicated to the advancement of minority communities and a deep understanding of the state's diversity initiatives. I know Tomas over the years, and I'm really pleased that he's accepted this position. Tomas will be focused on the state's Minority Business Enterprise Program, developing recruitment and retention activities to promote diversity, and ensuring compliance with the federal and state laws and regulations. I'm pleased that we're going to have a meeting with all the interested parties in the state with Tomas on Friday, and I'll make it very clear that we will follow state law and procedures and talk about the fact that the disparity report that took 30-plus years to actually happen, we need to change the legislation to allow that to happen on a regular basis, and we can determine what that makes sense, whether it's a 3, 5, 7-year time frame. We can debate that, but clearly 30-plus years on a disparity report is far too long, and we shouldn't accept that. So a quick look at the week ahead. Tomorrow we will be signing a slate of bills on women's health and equity. On Thursday, we'll be hosting a Rhode Island 2030 community conversation. This will be a recap of all the input we've received so far and look ahead to the next steps, and we'll be starting to outline those beginning next week. But we encourage everyone who has a thought about what Rhode Island should look like in 2030 to please reach out to our office, and so that we can connect with you if you want to have an idea about, on a topic that we should be covering, or any particular discussions that you would like to have in relationship to the future of Rhode Island over the next decade.